When nurses hear that the hospital sepsis fair is being heralded as a huge success both educationally and as entertainment.
It sure was. Who would have thought it could be so successful, so close on the heels of the Los Angeles County Fair?
Sepsis is one badass disease that occurs when a bacterial infection localized in one part of the body becomes more generalized and overwhelming. Examples would be pneumonia in the lungs spreading into the bloodstream, or a urine infection in the bladder overwhelming the body, or getting a baseball bat shoved up your ass.
Great analogy.
So we wanted a fair to help medical and non-medical attendees realize the importance of early recognition and treatment of this disease. Many of the elderly at attacks are demented without any recognizable enjoyment of life. Sepsis used to be these poor souls' last friend, allowing them to go peacefully into the night and die, but not anymore. We torture the hell out of them and prolong their suffering. The real kick in the ass is that we look like heroes and make a shitload of money doing it.
What made our fair so successful, however, was the real-time events that graphically allowed participants to experience having and get treated for sepsis. Shall I go on, Doctor?
No, shut the fuck up, please. In our first event, 5 volunteers were quickly rendered septic by serious infections such as tuberculosis, bubonic plague and tetanus. They got to experience firsthand having a breathing tube shoved down their throat, getting stuck in the neck, chest and groin by huge needles, and having CPR done on them.
Yuck.
Unfortunately they all died, but did so in a brilliant display of medical altruism.
The second and final event was the much-anticipated Sucks Then Smash 100-yard race. One of our ER staff, Dr. Greg Murphy, has held the world record distance in this event for 10 years. He faced the upstart talented Dr. Stephanie Lowe, also one of the ER doctors.
Each participant would be injected with a huge intravenous dose of the paralyzing drug Sucks, and then run as far as they could down a 100-yard football field, until they collapsed from paralysis.
Murphy, the mediocre distance runner in medical school, now can only be described as old, tired, and overweight. His remarkable longevity in the event is from his ability to channel the writhing muscle spasms called fasciculations that occur just before muscle paralysis, giving him noticeably longer distance. This has also earned him the nickname Snake. The young Dr. Lowe believes in becoming one with the medication. She also meditates during the race to slow her heart rate and thus slow the uptake of the Sucks into her bloodstream.
There was a surprise guest overseer for the race, wasn't there?
Yes, the controversial ER nurse known only as Nurse M, known to always inject patients with Sucks as often as she could.
In a stunning upset, Dr. Lowe broke the world record by 20 yards, and only required a few minutes of supplemental face mask oxygen after the race.
Murphy is still on a ventilator in intensive care. When asked about getting his ass kicked so badly, some say they saw him give a big thumbs up, while others say it was his middle finger that was up.